Hi, and welcome to the second episode of OnAir Healthcare, a podcast by Akin Gump that brings you to the intersection of policy, personnel, and politics. I'm Dr. Mario Ramirez, a consultant with Akin Gump and a practicing emergency medicine doctor.
And I'm Matt Hittle, a senior policy advisor with Akin Gump. Mario, it's awesome to be back with you for episode number 2.
Absolutely, Matt. Super excited to be here. And before we get started, I want to make sure that we thank the behind-the-scenes folks. I want to give a special shout-out to Jose Garriga, our senior communications manager here at Akin Gump, who handles all the operations, as well as Sean Feely. He's our policy advisor who edits all the transcripts. Thank you to both Jose and Sean.
Yeah, absolutely. Couldn't do this without them. So major thanks to them. Well, Mario, we've gotten a fantastic response from the first episode of OnAir Healthcare. Really excited for that. Thank you to all of our listeners so far for all of the ideas for the podcast. Keep them coming, please. But for today, we have a full episode. First, we're going to have Mario Ramirez talk about the latest COVID science, including CDC's new guidance for vaccinated people. And that is an update from our previous episode.
Absolutely, Matt. We're super excited to welcome 2 guests today. The first is Ed Pagano, a partner here at Akin Gump and former senior Democratic Senate aide, who's going to talk about what's on tap in Congress following the massive $1.9 trillion American Rescue Plan, particularly in light of the delicate Senate math that we have to use to get to 50 votes. And then second, we're going to have Akin Gump partner Clete Willems, a former senior Trump administration trade official, who's going to discuss the potential for the Biden administration to limit patent exclusivity for COVID vaccines, an issue that's come up for many manufacturers.
Thanks, Mario. And so we're going to turn first to a segment we're calling Capital Conversation, where we prognosticate about what Congress is likely to tackle. For that, we're turning to our colleague, Ed Pagano. Ed is uniquely suited to comment on these matters and all the goings-on under the Capitol Dome, given his long tenure both as a Senate staffer and a key Obama administration official. Thanks for being here, Ed. Why don't you tell our listeners about your background?
Thanks, Matt and Mario. I'm Ed Pagano. I've served as a Senate liaison for legislative affairs for President Obama. And before that, I served as chief of staff and senior counsel on the Judiciary Committee for Senator Patrick Leahy, Democratic of Vermont.
Awesome. Well, Ed, you're uniquely suited here, so let's dive in. Congress is coming off of I think we can all agree, a glorious 2-week Easter Passover recess. So I hope everybody's emails were a little less the last couple of weeks. Democrats are emboldened by their win on the American Rescue Plan. They have been looking to capitalize on that success with an infrastructure effort. The first question I have for you, Ed, was posed on Twitter this week, and it became a meme. What is infrastructure?
Infrastructure is in the eyes of the beholder. And I think this is going to be a long and winding road to the final package on infrastructure. This is the beginning of the debate, certainly not the end. President Biden has made a broad proposal. It's an outline. It is not legislative text. Congress will now delve into the details, and I expect a vigorous debate in the House and Senate in the upcoming months, defining what is infrastructure, what can be achieved, a majority vote in the House, very closely divided House, actually now 3 seats divide Republicans and Democrats in the House based on several confirmations of House members to the cabinet. That's really going to stay a very closely divided House. And then in the Senate is a 50-50 Senate. So any senator can be the king or queen of the caucus if they really care about an issue for or against it. So expect a rigorous debate and many twists and turns on the road ahead.
Well, let's dive into that a little more, Ed. So, even if infrastructure, whatever it is and however we define it, occurs, in some of the processes like reconciliation, Dems still have to get to 50 to end debate and pass the bill. Can you sort of help our listeners understand the complex dynamics kind of within the Senate Democratic caucus right now and, maybe what the path forward looks like on infrastructure?
Sure. So you're correct. We need a majority vote. So in a 50-50 Senate, that means that Leader Schumer must unite all of the Democratic caucus. So from Bernie Sanders on the left, Joe Manchin on the right, and 48 other Democratic senators in between. And infrastructure, although it's been talked about and actually, became a bit of a meme about Infrastructure Week in the previous administration, they're really delving in now to the details, but they're really new. Congress has not had this serious debate before. So we're going to have to see how it all sugars off, in a Vermont phrase. It's certainly going to be, I think, your traditional infrastructure definition, roads, bridges, highways. I think you probably have bipartisan support that broadband access, particularly in rural areas, but also in underserved urban areas, is part of the debate on infrastructure. That may not have been the case 20 years ago, but certainly we saw during the pandemic how important broadband access is for remote work and remote school. Then there are members of the House and Senate on the more progressive side that have talked about potential drug pricing, child care investments, climate change, housing, even immigration reform as potential parts of a infrastructure package. The key in the Senate on reconciliation, and I know it gets a little detailed, but in general, it is about what legislation impacts on a budget process, for tax and spending, and less on policy, and that enjoys the reconciliation protection, which in the Senate means a majority vote. Otherwise, you need 60 votes in the Senate to pass legislation, the so-called filibuster rule. So we're looking at a reconciliation package that will be determined in the scope of it by the Senate parliamentarian. And she has now become probably the most powerful person in the free world. And everyone will be trying to convince the parliamentarian, yes, this falls within the scope of reconciliation on one side, arguing against it on the other side. And as you saw with the debates on minimum wage increase that President Biden proposed, the House passed that minimum wage increase, and it actually was taken out of the Senate bill that became law because the Senate parliamentarian ruled that it was not within the scope of reconciliation protection.
Ed, after this is all over, I think we're all going to be experts in arcane Senate procedure, unfortunately.
Absolutely.
Sorry about that.
You touched on this a little bit. As our listeners know, the term infrastructure in the Biden-Harris context here includes, I think, $100 billion for broadband, as you noted, $400 billion for increased home and community-based services under Medicaid. That's about 1/5 of the American Jobs Plan, which is huge. And this comes on the heels of the pandemic in nursing homes and decreased census rates in nursing homes. The industry is reeling. Senator Sanders talked about lowering the Medicare age to 60. Just today, House progressives unveiled a wish list, including allowing Medicare to negotiate drug prices, which some Republicans would say is essentially price setting. So there seem to be poison pills kind of dotting the landscape here, and a lot of moving pieces on the healthcare front in particular. We've talked about the broad strokes here. Getting down to brass tacks, what's the realm of the possible?
That is to be determined over the next several months. Very ambitious plans by some members. Can they unite the Democrats? I think, as you mentioned, Matt, a poison pill is probably as the view of most House and Senate Republicans. We live in partisan times, for better or worse, and so I do think this package will go through the reconciliation route, so the route of a majority vote. And that process just becomes even more partisan. So I expect this infrastructure package to be Democratic support only, Republicans probably united or minimal support, depending on how the package evolves. All the provisions related that you just mentioned, these proposals are really going to have to be fleshed out, and are going to have to see, can they get a majority support of probably Democrats only, and we shall see.
Well, it's interesting. So, sort of on that point, the powerful House Energy and Commerce Committee recently had a legislative hearing on several bills that, would expand and build upon the ACA. And that looks like maybe a blueprint for House action on healthcare. If it is, do you think that a package like that could get to 50 votes? Or do you think that, some of the folks really in the progressive wing of the Democratic Party are going to have a hard time supporting something like that? Or is it going to be too paltry for those folks?
That is the $2 to $3 trillion question. Can the central Democrats agree on some of the more progressive proposals? Can the progressive Democrats scale back some of their ambitions? Can Speaker Pelosi corral both those wings in a House that is so closely divided? We're talking about 4 and 35 member House, and 3 to 4 votes right now divide Republicans and Democrats. So I know a lot of folks focus on the Senate because it's 50-50, and you can see it's one senator has a lot of power. But I would argue, given how close the House divide is, that it's maybe even tougher a task for Speaker Pelosi to unite her Democratic caucus on these details.
Interesting.
Well, and Ed, when we think about reconciliation, we think about the middle of the night markups, ramming legislation through with on partisan lines. Are we talking something that's going to happen very quickly? Well, what's the timeline here, and when do you think that stakeholders involved should start to engage?
I would engage now. The debate is happening. Speaker Pelosi has announced that she would like the House Energy and Commerce Committee and Transportation Committees to debate bills in the next coming weeks. The goal, I think, of reporting on things out of the committee by May. The goal of passing an infrastructure package in the House by July 4th, the July 4th recess. The Senate would then like to take something up in the July work period before the traditional August recess. And it's an ambitious timeline. I have to see if the House and Senate can meet that. But the details are being worked out, as we speak. Folks are really delving in, staff and members. And so my advice is now is the time to engage.
Well, there you have it, folks. Ed, thanks for that fascinating insight into the inner workings of Congress right now. I know our listeners appreciate your thoughtful insight.
Yeah, thanks for being here,
Thank
Ed.
you.
All right, Mario. We're turning now to a segment we call The Doctor is In, featuring you, our resident physician here at Akin Gump. Mario, in the last episode, we discussed CDC's guidelines for vaccinated people, but of course, as always happens, in the mere week and a half since we recorded, the guidelines changed again. This just emphasizes what we talked about in that first episode, which is CDC is pulling in so much information and trying to make, reasonable nationwide guidelines. It's a nigh impossible task because the science changes every day. But it's not just those guidelines. There seems to be a lot of churn coming out of government regarding COVID information, and it's kind of all against this backdrop of rising case counts in some places, plateauing case counts in others. So I want to start there. Could you give us a sketch of what's happening with these rising case counts? Are we actually headed for a surge?
Absolutely, Matt. It's such a good question, and I think one of the real challenges of, working in public health and that CDC faces every day, right, is that you're trying to cast a message that is, applicable to the entire country, but that at the same time is flexible enough to, reflect what is happening individually on the ground, which in a lot of ways is different from place to place. And so I think, if we step back from the guidance for just a second and to answer your question about whether we're headed for a surge, there are really two competing trends that we're seeing right now. And folks may have heard about this foot race against the variants. And so let's break down what that means exactly. A couple of months ago, we preferentially targeted vaccination towards older Americans. And what we're seeing is that the number of cases and the number of hospitalizations and deaths in older Americans has continued to drop, which is all great news. But conversely, what we are seeing is that the number of cases in younger Americans those people who are aged 20 to 50 are really starting to increase. And the concerning sign is that the rate of increase, or the acceleration, is increasing in those groups. And that's primarily driven by two things. So the first is that people are out moving around more, right? We've started to open schools. We've started to open businesses. Some of the states have removed mask mandates. But then the other part is the variants. And, the variants has sort of become the buzzword, in the country right now, particularly related to COVID. But what folks need to know is that these new variants seem like they attack and infect younger people much more efficiently than the original strain of coronavirus. And so when we hear these mixed messages about, things are getting better, but case counts are going up, that's why. Because for particular groups of Americans, particularly younger Americans who haven't been vaccinated yet, the situation is still pretty dangerous out there. The good news is that we're vaccinating more Americans on a daily basis. And if we can really get vaccines into those younger folks over the next 2 to 3 months, then I think we're going to be well positioned to kind of continue the downward trajectory. If we can't get those folks vaccinated, then it's likely that we're going to see a sizable surge, heading into the summertime.
Got it. Okay. Well, with that groundwork, let's dig into what the CDC has said recently with respect to vaccinated people. As you recall, we discussed this on the last episode, and since then, CDC updated its guidance. So give us a summary of what the update is and what it means, particularly for travelers, because I know we're about to hit the summer travel season here.
Yeah, you're right, man. So I think there's three issues that are worth highlighting for listeners real quick. So, one of the questions that I raised on our first episode was that the guidelines really did not address travel. And I think a lot of folks brought that up as well. And since then, the CDC has come out and said that if you have to travel, they're still calling it essential travel, not recreational travel. But if you need to travel for essential purposes, that travel is safe in the United States and internationally, provided that all of the public health measures are in place during your transit. And so that means specifically that people are using masks, that they're continuing to socially distance in airports, and that they're continuing to wash their hands and sanitize things frequently. And that's a big change, right? Now, we know, just looking at the travel numbers from TSA and from the airlines, that people are clearly traveling for more than just essential purposes. And so, people, I think, are pushing beyond the CDC guidelines. But this is the first recommendation we've seen that it is, in fact, okay to travel on airplanes from the CDC. And that's really kind of a watershed moment, I think, in terms of getting the country back to a place where people feel like they're able to move around. Now, the important piece of that, and I can't highlight this enough, is that it applies to vaccinated persons who have completed their vaccination series. So that's either 2 weeks after your second dose or 2 weeks after your single dose of the Johnson & Johnson vaccine. That's the first big kind of policy announcement that we saw this week. There were two other things that are worth highlighting, though. So in addition, the CDC updated their transmission guidance for surfaces. An ongoing question when the pandemic first broke out was how long the virus was viable on hard surfaces and how much cleaning and disinfection needed to happen. And I think this is important, right, because this is a big piece of getting folks back to work, about getting schools reopened. And what the CDC essentially said over the last week was that the virus is not viable on hard surfaces after 3 days, and probably much shorter periods than that. They emphasize that deep disinfection on a daily basis is probably not needed, that there is still some risk. There will always be risk present, but the majority of coronavirus spread happens through respiratory droplets. It's not happening on what we call fomites or surface kind of contaminants that are then being spread to people. And so I think this is going to go a long way to shaping some of the guidance from OSHA and, the EPA and other groups that have a handle on, how do we clean, how do we disinfect things? So that was another kind of policy change that's coming down the pike. And then I think the last thing that I want to highlight for folks was that the CDC edged closer. They didn't quite definitively say it, but edged closer to saying that the vaccines are actually helping to stop transmission. An ongoing question was whether or not, if you have been vaccinated, are you still capable of asymptomatically spreading the virus? And the CDC director, Dr. Willems, cited a good-sized trial of hospital care providers who had been vaccinated, about 4,500 personnel, and then also looked at data from the UK and looked at data from Israel and saw that the transmission dynamics dropped off considerably in vaccinated individuals. Now, it's not quite enough to say with 100% certainty, that if you're vaccinated, you're not transmitting it, but we're getting closer to that point. And I think the CDC and other public health folks are wary of saying that something is absolutely impossible without a sizable body of evidence, but we're continuing to build that body of evidence.
I have to say, I'm just happy that we can end the sanitation theater, the spraying down of every surface. I remember I would wear, latex gloves and I'd pump gas several months ago. And so I'm just happy we don't have to do that kind of stuff anymore. But CDC does have, like I said, an impossible job. They've just got to be very cautious before they make a judgment call because mistakes can potentially cost lives. So we all understand that. The CDC is under incredible pressure to deliver quickly. People are getting their vaccines saying, okay, well, I want to go take my international trip now. Please tell me I can do that. But they're being cautious. So how soon should we expect CDC to issue kind of the next big tranche of policy news?
Yeah, so this is kind of reading the tea leaves a little bit, Matt. We don't know for certain, but I think that we've probably seen all of the major policy updates that we're going to see from CDC for a few weeks. I think there are certain things that people are really looking for specifically. I think folks want to know, when can we start to have mass gatherings again? When can we have, concerts? When can we go back to the theaters? And also, when can we start going back to work in person? But what I think the CDC has said, right to my point earlier, is that they're not going to issue specific new guidance until there is a solid body of evidence, that definitively says something is safe, or at least is able to quantify or stratify, the risk of doing something. And in fact, they only changed their recommendations about schools and the 6-foot versus 3-foot rule when there were a couple of big studies that came out, in short order just a few weeks ago. So, I think we have not seen that there is a lot of data that is about to be released on, some of this mass gathering stuff yet. And so, I think the next set of big policy announcements are probably several weeks away.
Got it. Well, let's talk about work. You referenced returning to work, and many of our listeners, I'm sure most of our listeners, are listening from home rather than the office. After over a year of remote work, people are wondering when they will get to or have to go back to the office, depending on your perspective. OSHA, which governs workplace safety, was supposed to issue temporary employee standards by March 15th. That deadline came and went. So lots of employers are now waiting and wondering when to expect it. What's your take here?
Yeah, a lot of us were really watching this March 15th date pretty closely, and we expected that OSHA was going to issue this temporary employee standard, on or before that date. And, there was a lot of discussion about what that was likely to include, because it could potentially have huge ramifications for returning to work. I think most of us had expected that the temporary standard would be in place for about 6 months, and might include a requirement that employees wear masks, that it might include, improved guidance about cleaning, possibly require social distancing and kind of keep this 6-foot rule, as something that employers had to maintain. And then there were big questions about, the responsibility of employers to report, symptom outbreaks in their facilities and how they would report testing results. And also, what is the responsibility of employers to actually conduct testing in the workplace? That was really the guidance that I think a lot of us were looking for. And instead, to your point, they decided not to issue that temporary standard, but instead have said they're going to use something called the National Emphasis Program. And in some ways, I think this reflects the fact that the science is changing very quickly right now. So if you're an OSHA and you issue a temporary standard, and then, your CDC counterpart, says that the science is actually different on this, it's a tough thing to go back and revise those rules in real time in a way that employers can adjust for, sort of on the fly. And so instead, I think OSHA has issued this National Emphasis Program where they've, identified key, industries where they, have either seen evidence of increased spread, or they believe that the conditions are such that they're sort of ripe for increased outbreaks. And, in particular, they have said that they're going to focus on, industrial agriculture, as well as meat packing and, sort of food plants, because folks work together in tight quarters, and those areas have been sources of increased spread. It sounds like OSHA is directing their inspectors to emphasize inspections, particularly as we get into the summer and into the fall. But there are still many people who believe, that a temporary rule could be forthcoming. So we have to wait and see.
Okay. Well, in the meantime, what are employers and employees to make of kind of the current landscape? And I guess what I'm asking here is, when should we start the workout regimen to ease the transition from sweatpants to suit pants? And I'm asking for a friend.
Well, if you're like me, you probably put on a couple of pounds during the pandemic. And, I think maybe a better way to say is, when are we going to be going back to the beach, and when are we going to be going back to the work, and when should we start to bring some of those pounds back off? And I think those changes are probably, pretty soon over the next few months. Like I said about case rates, the real question is going to be what happens with that younger population of folks, and how many of those folks can we get vaccinated, and how can we convince that population to really opt into vaccination? The message that we heard earlier in the pandemic was that this was not dangerous for younger folks. I think has shifted a little bit with some of these new variants that have shown to be more dangerous in younger folks. So, the vaccines look like they work well against these variants that are out there circulating. And so if we can get all of those folks vaccinated, then I think it's time to start toning up and getting ready to head back to the workplace soon, because if we get all those folks vaccinated, then these case counts are going to drop off really quickly. On the other hand, if folks choose to opt out, or one of these variants breaks out of the vaccines, then, this may continue for a little while longer, and we've got a little more time in sweatpants to go.
Got it. Well, before I head out on my jog, one more question for you. Last episode, we recorded a piece about the guidance, and it changed quickly. So we had to quickly record a caveat. So for our editor's sake, how settled is this guidance for vaccinated people right now?
So I believe it's pretty settled, Matt. I think that our editors can rest assured that there won't be late nights. I think maybe another way of asking your question is how confident do we have that these vaccines are going to keep working and that the guidance isn't going to change? And like I said, right now, all of the studies that we have show that the vaccines work really well against the variants. I think there's going to be two key things that we're looking out for that might potentially shift any guidance. So the first is whether we see any of the variants that we sequence show the potential of breaking out against the antibodies that the vaccines produce. If we see something like that, we'll conduct the mixing studies in the lab, and we'll take a look and we'll see, if there's something that looks concerning. But then, like I said before, the other thing is whether we start to see vaccinated persons getting sick and being put in the hospital. Some of these vaccines, particularly the single dose candidates, don't prevent all infection. They prevent serious infection, and at some point, the conversation is going to shift away from just raw case numbers, right? And it should specifically focus on how many people are being hospitalized and how many people are dying, because those are really the most important metrics. And so, I think if we see changes around those, then we might see some of the guidance change. But for now, things like those recommendations are here to stay.
Got it. Mario, thank you very much. We're calling our next segment Patent Pending, and we're talking about a recent push by some countries led by India and South Africa to waive patent exclusivity for COVID-19 vaccines. So to dive into this today, we're turning to Clete Willems, a partner at Akin Gump and former senior trade official in the Trump administration. Welcome, Clete. Tell our listeners about your background.
Sure. Thanks so much for having me on today. As you mentioned, I'm a partner now at Akin Gump. And I joined Akin about a year and a half ago from the Trump administration, where I was the deputy director of the National Economic Council, and I was also part of the National Security Council. And prior to that, I worked during the Obama years at USTR, at the U.S. Trade Representative's Office. And I started my career on the Hill with Congressman Paul Ryan. He's my home district congressman from Wisconsin.
Great.
Well, we're glad you could be here, Clete. So, Clete, I've got a question. Last fall, several countries, particularly led by India and South Africa, petitioned the World Trade Organization for a suspension of intellectual property protection around COVID vaccines, right? And I think we, are all aware of the inequitable access to vaccines around the world. But, can you give us just an idea of what this would look like and where the issue stands? I know there's a lot of hot button issues here, and we'd love to get your thoughts.
Sure. This is the issue that we call the TRIPS waiver, and TRIPS is an agreement under the World Trade Organization. It actually stands for the trade-related aspects of intellectual property rights, and it's a multilateral agreement to which the United States is a party. India, South Africa, Europe, China, all WTO members basically signed up for this, and it requires the signatories to protect intellectual property in their markets. And it lays out different conditions for how you're supposed to do that. And it covers the whole gambit from patents to copyrights, industrial design, and everything in between. And what India and South Africa proposed starting last October was basically that broad provisions in this agreement, a broad range of provisions throughout the agreement, should be waived because intellectual property protection was serving as an impediment to the distribution of vaccines around the world. And that's been their argument. Now, it was a couple of interesting things about it. A lot of people, when they think about this issue, they think about patents. But India's proposal actually applies to a whole bunch of other stuff not related to vaccines, like copyright. And the other point that I think is interesting is they actually made this proposal before there actually was a vaccine that was being distributed. So some interesting aspects to it, and we can get at why that is. But long story short, they made this proposal in the fall. They've tried to get support for it. The United States, Europe, and others have, certainly during the Trump administration, were very opposed to this, really saw it as an effort by these countries to undermine IP, which has been a longstanding interest of theirs. But now the Biden administration is thinking about what it's going to do.
Well, let's dig into that, Clete. As I understand it, the administration plays a key role here. Describe what that role is for our listeners and how that, you mentioned there's a shift over time. Describe the shift, and please put it in the context of the political dynamic, because as our listeners all know, everything is dependent on the politics.
Right. Well, sure. So, we shifted from the Trump administration to the Biden administration, and one thing the Biden administration has said is that it wants to try to be a more constructive player in international institutions. I think at the same time, the Biden administration feels like it's under pressure in what I would call the debate over vaccine diplomacy. And you have China and others sending vaccines around the world, and the U.S. wants to show that it's doing its part to try to vaccinate people outside of its borders as well. So you have this dynamic that exists, and I think you're getting pressure from Congress as well, from on the Democratic side. In particular, saying we need to be a good actor at the WTO, and we should consider this waiver, and so they're looking at it, and there's been a robust interagency process that's underway. There's a lot of key players here, but I'll highlight a few. First, there's USTR, who really is the lead on this issue because they represent our interests at the WTO. There's the National Security Council, who is really focused, I think, on the diplomatic elements of this, along with USAID. And then you get other agencies like Commerce, and in particular their Patent and Trademark Office, who really cares about how U.S. intellectual property is treated within these international organizations. So they're just some of the key players that have been talking about this, debating this issue, and trying to come up with a path forward.
So, Clete, I heard you mention China in there. Let me expand that to Russia as well. Where do China and Russia fit into this equation? Would they benefit from the waiver, or what's their position on this?
Well, now you're getting down to the substance, and I think I've been trying to give sort of a high level overview of the issue itself. But when you turn now to the substance and the question of whether or not we should do this, the argument again that you hear in favor of this is that the U.S. has to do its part, and that this will somehow increase vaccine distribution around the world. Now, the counter argument that you hear to that, and this is where I'll bring up China, but let me start with the first counter argument and then the second argument on China. I mean, the first counter argument, and the one that I happen to believe, is that that's just false. that this will not actually help with vaccine distribution. The problem is not IP. The problem is just the lack of distribution channels around the world. And just to give you an example on that, well, let me give you two examples on that. I mean, first, you have the ability for countries to license this technology. And the United States has licensed its technology to Indian companies, in fact, who are producing this in India. India has a Serum Institute which has worked with AstraZeneca. Gilead has also worked with manufacturers in India and basically licensed their technology to them so that they can produce this. And if you can't get an agreed upon license arrangement with a U.S. company or a European company, there's also provisions in the TRIPS agreement called compulsory licensing, where you can actually work with. If you try to get a license on reasonable terms, then and you're not able to achieve that, you're able to do what is called a compulsory license, where you basically do it by force. Now, the problem then with India's proposal is it's basically trying to ignore all of that stuff, circumvent all of that stuff, and say you just need to give away this technology for free. And again, I think my view, very clearly is that U.S. intellectual property protection is part of the reasons we have the most innovative companies in the world who are producing this, and further that intellectual property protection is not an impediment, because as I mentioned, you can have licenses, or you can even have compulsory licenses. So to me, it looks like this is just part of India and South Africa's longstanding efforts to undermine intellectual property rights through the WTO, and really doesn't have anything to do with COVID. That's just the latest excuse. Now, I promised I'd talk about China, and I know it took me a little while to get there, but I thought this other context was important. When it comes to China, the issue is really this. China has identified the pharmaceutical sector and advanced techniques of manufacturing these drugs as part of its Made in China 2025 plan, where it wants to dominate these industries, wants to be the world leader in them, and wants to surpass the United States. So this sector is a core part of its ambitions for dominating industries in the future. What we also know about China is they utilize a lot of tools, unfair practices to achieve those goals. And one of the things that they utilize is a policy called forced technology transfer. And there was, many of you know who follow U.S.-China trade relations, that there was basically a whole trade war fought over this issue. It's something that both Democrats and Republicans have widely condemned. And the problem here, of course, is that basically what you are doing is, if you endorse this TRIPS waiver, you are endorsing a system of forced technology transfer in an industry that China is trying to dominate in the future. And so you're basically aiding and abetting China's Made in China 2025 ambitions if you endorse this TRIPS waiver, by basically breaking down the international rule set that is intended to protect these kinds of things from those kinds of practices. And I think that is a political dynamic to this that I think initially, when the Biden administration started looking at this, they didn't fully appreciate, and I think now has really, I think, especially for the national security types, has really gotten them to be a little bit more nervous about what endorsing this would really mean.
Clete, it seems like this fig leaf of reducing patent protections to assist poorer countries is covering up this deeper substance that you just went into, which I think is really important. But you're not the only one who's identified this cover. The Wall Street Journal recently released an editorial suggesting that vaccine manufacturers are already, to your point, sharing intellectual property, and stated, quote, even if the WTO suspended patent protections, India and South Africa would still couldn't make vaccines without cooperation from developers. End quote. And the associate director for innovation at the Duke Global Health Institute said the proposal was, quote, more symbolic than practical, quote. So do you think that it would even be worth it to entertain this, given the really serious implications with respect to the non-IP issues that have been bubbling up for some time. Is the fig leaf here even worth it?
No, I don't think that it is. And I think you said it well. You have a proposal on the table that's going to undermine decades-long U.S. policy that promotes the protection of intellectual property rights through the international trading system, recognizes that strong IP rights are the best way to lead to innovation in a given industry. You're going to undermine that principle, and you're not going to get anything in return. And I think what the U.S. has started to look at, and that I think is a much more preferable approach, is what are the ways that we can actually create distribution channels and facilitate the sharing of vaccines with poorer countries around the world, with countries that don't have the same access that we do in the United States. I mean, don't get me wrong. That is a laudable goal and one that we should be trying to achieve. I just don't think this proposal is the way to do it. And, Bill Gates actually has said something similar about that and about the need to basically, fund the distribution. And a lot of folks have looked at past examples where we've done something like that. PEPFAR was an example way back when in the Bush administration, where we were distributing drugs throughout Africa to deal with health issues that they were having. And we put a lot of funding behind that. We put a lot of money into building up distribution channels instead of totally undermining IP because we recognized it wouldn't actually solve the problem. Now, one thing this administration has done that I like is it did enter into a partnership with the Quad countries, which interestingly includes India, along with Japan and Australia. And basically, this proposal would put U.S. money behind trying to distribute vaccines to the developing world. And it doesn't deal with the IP. Recognizes IP is not an impediment, but it does recognize that money is an impediment and distribution channels are an impediment, and tries to use that as a way to achieve this. And I think that's a much better approach. Looking at what we did through PEPFAR is a much better approach. We should try to achieve this goal. Let's just not do it in a way that undermines longstanding U.S. policy without actually achieving what they're trying to achieve.
Interesting. I want to drill down on that just a little bit more, Clete. So, I think we can all recognize, and the economists and other groups have brought attention to the fact that, the vaccine in underdeveloped countries is pretty slow going at this point. And, personally, one of the things that I've supported has been the U.S. re-engagement in the COVAX effort, which is a pointed effort to try to distribute vaccine to those countries. But if relaxing patents isn't part of that, is it strictly distribution, or are there other issues that are also at play here? I know indemnification and, some of these other things around injury claims and other things are also out there circulating. What else do our listeners need to be thinking about here?
Well, I think you hit the nail on the head with indemnification. That has been a problem as well. And I do think that, maybe there are ways that the U.S. government could try to provide some of that assurance to U.S. companies if the countries themselves that are going to be the recipients of the vaccines aren't able to do so. But at the end of the day, I think I would hope those countries could get there on indemnification, because if you do want to have access to this, you're going to need to do everything on the ground to facilitate your ability to receive that drug. I would also say another issue that we haven't yet touched on is the issue of export restraints. And there are a lot of countries around the world who are putting in place export restraints on their ability to send this stuff abroad. So if it's produced in Europe, can it then be distributed or sold in the UK? That's been a hot button issue. India itself, interestingly, has actually put in place export controls as well. As I mentioned earlier, India has licenses from U.S. and European countries to produce this drug, or to produce this vaccine, and they have now put in place export controls to prohibit those drugs those vaccines from being sent abroad until June. So I do think it's a little bit ironic that the U.S. is feeling pressured and feels like it's being portrayed as the bad actor here, when a lot of other countries around the world are also taking actions that seem, very much focused on protecting their citizens and really not looking at the global picture. So I do think this is a little bit more of a complicated issue than is being portrayed as, oh, the U.S. just needs to do its part. We all need to do our part. And I think, like I said, distribution, export restraints, indemnification, these are all part of the solution.
So, Clete, what is the timeline here? We've talked about the substance of the issue. I want to get to the nuts and bolts. What is, you mentioned some of the relevant agencies within government that are considering the waiver. What has to happen going forward? When do you expect it to happen? When will the Biden-Harris administration actually make a decision? And what do you expect that decision to be?
Yeah, no. So I think in terms of the timing, there isn't a specific action forcing event in the sense that the WTO meets regularly. It discusses this and other issues. And, the next meeting of the TRIPS committee is going to be in June. They could always call an emergency meeting, which would sort of force, the U.S. to decide, is it going to maintain the same position that they did under the Trump administration in blocking this? So there are also conversations in Geneva. The new Director General of the WTO has been convening meetings to discuss this with manufacturers. And I think she's been trying to be productive here. She hasn't come out and endorsed the waiver. She hasn't come out and opposed the waiver. And she's basically doing what she's calling the third way solution, where she's trying to figure out, is there a better way of cooperation and facilitating these exports without having to necessarily require the forced technology transfer of this sensitive IP. So my point is, there's no action forcing event. So it really just comes down to, how much pressure does the Biden administration feel to get to an answer here, based on what it's hearing from Congress and based on what it's hearing from the international community. And, I think this has been going on. They've been discussing this for, I think, over a month now. They've been holding interagency meetings. USTR is now hosting meetings. They call them the TPSC. It's the Trade Policy Study Committee that hosts interagency meetings to come up with solutions. And, that process will take at least, I think, a couple more weeks to work itself out until they'll come to an answer. In terms of where they land, again, I think there are different agencies with different opinions. And I think USAID is pretty forward-leaning on this. I think elements of the NSC may be forward-leaning on this. I think our agencies like Commerce Department and PTO, would be inclined to be opposed to this. I think, the career folks certainly at USTR understand that this would reverse decades-old U.S. positioning on IP, and I think they would be inclined to be opposed to this. So they're going to have to work all that out. I mean, I personally think at the end of the day, that it would be a huge mistake for them to come down on any way other than opposing this. I think if you just think of, as I was talking about earlier, sort of the global competition with China to come out and basically endorse technology transfer of mRNA, very sensitive technology, to China would be a huge mistake. And one thing I haven't mentioned is a lot of this technology was actually it was funded by DARPA. So it was defunded by our Defense Department as a national security strategic priority. And that was part of the way that they came up with this technology that produced these vaccines. And so for us to give DoD-funded research over to China just doesn't make a lot of sense. And I think that as that becomes more and more clear to the Biden administration, I predict they'll ultimately do the right thing here.
Interesting. Well, that's super fascinating, Clete. Clearly, this is a complex issue with a lot of different sort of nuances that, I'm sure our listeners are interested to learn more about. So thanks so much for coming on the podcast today.
It's my pleasure.
All right. Well, that'll do it for this second episode of OnAir Healthcare, your podcast here with Akin Gump. I'd like to give a special thanks to our guests, Ed Pagano and Clete Willems.
Absolutely. It was a fantastic episode, chock full of information. Be sure to like and subscribe to get more. And as always, if you have ideas for episodes, or of course, if you'd like to compliment us on our radio voices, our email addresses are in the description.
So signing off, I'm Mario Ramirez.
And I'm Matthew Hittle. Join us next time on Akin Gump's On Air Healthcare.
On Air with Akin Gump is presented by Akin Gump and cannot be copied or rebroadcast without consent. The information provided is intended for a general audience and is not legal advice or a substitute for the advice of competent counsel. Prior results do not guarantee a similar outcome. The content reflects the personal views and opinions of the participants. No attorney-client relationship is being created by this podcast, and all rights are reserved.